Gentlemen, now it is my honor to introduce the final distinguished speaker for the day, Professor Dr. Waseem Rizvi, sir. Dr. Waseem Rizvi is a highly respected professor and chairman of the Department of Pharmacology at JN Medical College, AMU, Aligarh. He has over 20 years of teaching and research experience. Dr. Rizvi's research interests lie in the identification and isolation of active principles from natural sources. He has been actively involved in the screening of indigenous plants for biological activities, such as antifilarial, anti-inflammatory, and hepatoprotective properties. He has published more than 41 research articles in various prestigious journals, including the British Journal of Clinical Pharmacology, Biomedicine and Pharmacotherapy, European Journal of Pharmacology, Phytomedicine, Journal of Oriental Pharmacy and Experimental Medicine, and Journal of Natural Remedies. In addition to his research accomplishments, Dr. Rizvi has supervised over 11 MD theses and published a working laboratory manual on experimental and clinical pharmacology. Today, we are fortunate to have Sir share his expertise and knowledge with us on the topic on Institutional Ethics Committee. I'm confident that his insights and experience will be valuable to all of us in attendance. Please join me in welcoming Dr. Waseem Rizvi. Over to you, sir.
Okay, thank you very much. Now, my topic is Institutional Ethics Committee. Now, before going into what actually Ethics Committee is, let us discuss a few points in brief about the historical perspective of this Ethics Committee. Now, the first international treaty which was signed regarding the historical perspective of use of human participants in clinical research was way back in 1947. That is known as the Nuremberg Code. Now, following this, in 1964, another historical important event happened. The World Medical Association, they provided the guidelines for the use of human subjects or participants in clinical research, and this is known as the Helsinki Declaration. Now, the third important event that happened after this was in 1979, which came out as a Belmont report in the US, again laying guidelines for the use of human participants. The historical perspective, the third event that occurred was in 1979, which came out as Belmont report. Again, this was certain guidelines laid down for the use of human participants or human subjects in the clinical trials or this clinical research. Now, this was the first time in 1979 that it stressed mainly on three important principles or basic principles of human research: is the respect, beneficence, and justice. These all three basic principles are applied wherever there is use of human participants in clinical research. Now, if you talk about the Ethics Committee, how it is defined. Ethics Committee is actually an independent and competent committee which actually reviews, evaluates, and gives decisions on the scientific and ethical merits of the research protocols. So it actually consists of both medical and non-medical scientists. It's a balance of medical and non-medical scientists. They review the protocol submitted for the clinical trials or clinical research on including the human participants. Now, what are the different types of ethics committee? Ethics committee is actually divided broadly into two categories. One is the independent ethics committee, and second is the institutional ethics committee. Now, this institutional ethics committee is further, the institution can have more than one committees. It could have ethics committee for the clinical trials, that is, they give permission for the clinical trials and bioavailability and bioequivalence studies. It is registered with the Central Licensing Authority, DCGI. And the second committee is the Ethics Committee for the Biomedical Research. And this is registered with the Department of Education Research, Ministry of Health and Family Welfare, Government of India. Now, this Independent Ethics Committee is actually the independent committee which is not in any institution. it is independent of the institution. So the independent ethics committee is there for those individuals or researchers or workers who are not affiliated to any institution. So they can go to the independent ethics committee and they get approval from that independent ethics committee. Independent ethics committee works at the level of region and national level. Now, this independent ethics committee cannot take proposals from the person who are affiliated to certain institutions unless they have a signed memorandum of understanding with the independent ethics committee. So wherever those institutions who do not have their ethics committee, they can go to the nearby institutions where there is an ethics committee, or they can approach the independent ethics committee if there is MOU signed with the institution with the independent ethics committee. Now, what is the composition of ethics committee? Now, ethics committee is actually, I said, it is multi-sectorial and multidisciplinary. So it has clinicians. These clinicians can be from both within the institution and outside the institution. They can have 2 clinicians can be there. Then they have medical scientists. Now, these medical scientists, again, they can be from within the institutions and from outside the institution. So we have 2 medical scientists, and preferably a pharmacologist should be there as a medical scientist for those clinical trials where there is use of drugs. Then it comprises of legal expert. This legal expert can be either affiliated or non-affiliated. That is, it can be either from one legal expert is there who can be from within the institution or from outside the institution. Then we have independent members like social scientists, representatives of a particular NGO, philosophers, ethicists, theologians. Now they can have 2 independent members, one from the affiliation and the second from the outside the institution. Then a layperson is there. This layperson is always a non-affiliated person. That is, it is from the outside the institution. And then obviously we have the heads of the committee in the form of a chairperson who is from the outside institution, non-affiliated person. And then we have a member secretary, which can be from the institutions itself. So this is the composition of the ethics committee. And in this ethics committee, at least one of the members should be a female member. This is as per the latest, that is 2019 guidelines, where a female member is an essential member of this composition. And all the members of the ethics committee should undergo some sort of certification in clinical trials, and they should have GCP certificate. They should be GCP certified. Now, the institutional ethics committee for BA studies, the composition is as per NDCT rules 2019, and for EC for biomedical and health research as per ICMR 2017. This is the composition. Now, as per this, the rules of the NDCT and rules of the ICMR 2017, as I said, there is a change that one member should be a women member. And this registration by the NDCT is for 5 years. Previously, it was for 3 years. It has been extended to 3 or 5 years now. And for the biomedical research, the registration is for 3 years. And all this composition, out of these members, it should comprise of at least 7 to 15 members. You can have 17, 15 members. And out of these, 50% of the members should be from the non-affiliation, that is outside the institution. This is a prerequisite. And any change in the composition of the ethics committee or biomedical research should be duly informed within 30 days to the registering agency. Now, before going into the individual duties of the members of the ethics committee, there is one term which is used commonly, that is terms of reference. Terms of reference is a document TOR. Now, what is this TOR? That is terms of reference. It is actually, it is a document which contains the aims, the scope, and the duties of the members. So, the head of the institution, maybe a director or the vice chancellor, ideally should not be, as per the rules, ideally should not be a part of the EC. But the actual appointments of the members is made by the head of the institution, be it vice chancellor, or be it director, or anybody. So the head of the institution decides the appointments of this ethics committee members, including the chairperson. So in the TOR, you will find that a letter of appointment is given by the head of the institution to the individual members, and this TOR contains the individual duties of the members, what duty an individual member is to perform. It also contains the term of appointment. It is approximately 2 to 3 years, and it can be extended further. So the term of each member is 2 to 3 years, and it can be extended further. It also contains the amount of honorarium to be paid to the individual while attending the meeting. So honorarium is also there. Reasonable honorarium is mentioned in the TOR. And in the TOR, it is also mentioned that each member of the committee shall undergo a training program, which is very essential, so that they keep abreast with the recent rules and guidelines they follow for assessing the scientific and ethical merit of a particular research protocol. So certain GCP guidelines, regulatory guidelines as available or as mentioned by the regulatory authority. They should undergo training programs regularly from time to time. So it is mandatory. Why I'm saying this mandatory? Because if a person is not certified or is not undergoing training, then it becomes a point for his discontinuation as a member of that ethics committee. Now, talking about the individual duties of the members of the ethics committee, what role they play in the ethics committee. First of all, the chairperson. Chairperson should be, as I said, should be from outside the institution, and he should have any background. He could be of a medical background or non-medical background, and he should be a respected person, and he should have a prior experience in this position of this ethics committee. Either he is heading the ethics committee, or he has prior experience in the functioning of the ethics committee. Now he is responsible for the conduct of the EC meetings and is accountable for independently handling an efficient functioning of the ethics committee. It is his duty to ensure the active participation of all members of the ethics committee, and its duty is to ratify the minutes of the previous meeting. That is, ratify means that all those decisions which have been taken in the previous meeting of the EC, they are put before the present EC meeting, and they are made, confirmed in the present meeting. So it is ratifying the minutes of the previous meeting. Now, there's another important factor is conflict of interest declaration by the members of the quorum. Now, without this declaration, it is the duty of the chairperson to seek the conflict of interest declaration before the meeting by the members of the quorum to be fair in their decision making. Next is, it is the duty of the chairperson to handle complaints arising out of the research project, that is a continuing or ongoing projects. Then complaints may arise in the form of the conflict of interest or issues related to the request being put before the chairperson for the use of the EC data. Actually, this EC data is very confidential, and privacy is to be maintained by the EC. It is not commonly shared by the public. It is not commonly shared in the public domain normally. But if there is some order from the High Court, then the permission of the chairperson is to be taken before forwarding it to the court. The member secretary, as I said, is an affiliate member. It is from the institution, and member secretary should design, member secretary should design an appropriate method for collecting, evaluating, and forwarding, and then maintaining the records of all the proceedings, all the protocols which arrive for being put in front of the the EC. He organizes EC documentation and communicates with the members. He ensures, as I said, training is very important. As far as to become a member of the EC, it is very important to undergo training from time to time. So it is the duty of the member secretary to ensure that the training, appropriate training has been done for all the members of the EC. Then this is another important document, SOPs. For every EC in every institution, every EC should have a SOP, standard operative procedure. That is how to go about the meeting, what is expected from them, how to perform those duties. So they have to prepare an SOP, and this SOP is not a one-time process. It has to be updated from time to time. And it is again the duty of the member secretary to organize this, that he should ensure that SOPs are updated as and when required. Now again, from the ongoing projects, then problems can arise, or there can be reports submitted by the auditors or submitted by the sponsors or the principal investigators. He should be prepared to respond to, should analyze those reports, and should be in a position, should be prepared to report and to answer those queries and those questions which are there and those problems which are there in the audit reports. Now, the member secretary has the power to assign the protocol functioning or the evaluation part of the protocols. He can call on special consultants, he can hire them, or he can ask a subcommittee, that is a scientific review committee within the institution. He can place all those protocols before the scientific subcommittee, and then he decides whether a particular protocol is for the expedited review or should be exempted from the review or should go in for a full review before the EC. Then about the clinicians. As I said, clinicians, they have a very important role to play in the review process. They should be qualified in their respective disciplines, and they should have expertise and training in the clinical research and ethical research from a recognized institution. As they are responsible for the scientific review, they are supposed to review the protocols, which includes the benefit risk analysis, designing of the protocol, the actual methodology of the protocol, what sample size is to be taken, whether it is sufficient for that particular study or not, the site where the study is to be conducted, and what statistical methods are applied. Now, again, the ongoing review protocols. Ongoing review of the protocols, that is for those projects which are ongoing. So in those projects, if there is issues like occurrence of a severe adverse event, or there is deviation or violation of progress, if he finds that there is deviation during the process, it is his duty to analyze those and report them to the EC, and then further reporting is to be done. Now again, the duty of the clinician is to look at the site where the project or the trial is going on. For what? For the review of the medical care. That is, if some adverse event occurs to the participant, then what medical care, what is the level of medical care that can be given to the participant if he suffers from any adverse event. Then facility, that is logistics and infrastructure, and the qualification and the experience of the principal investigator at the site of the clinical trial. And if the situation arises where some severe adverse event occurs and there is injury during the course of the clinical research, if some injury occurs to the participant, then what management and compensation is to be given is to be decided by the intern in contact with the clinician. Then talking about the medical scientists. As I said, if the medical scientists, if the clinical trial involves use of drugs, then preferably it should be a pharmacologist. Otherwise, medical scientist can be a non-medical or a medical person with a basic qualification in medical science subjects. Now, again, the more or less the functioning or the role of the medical scientist is very similar to that of a clinician. That is, it reviews the scientific content or the scientific merits and the ethical review of the research proposal in terms of benefit risk analysis, designing, methodology, stats, occurrence of severe adverse events, protocol designing, progress and completion report. That is right from the review process until the process is completed. It is progress and completion report is for those projects which are ongoing. So it evaluates, the medical scientist evaluates the ongoing process projects also for occurrence of severe adverse event, project deviation, progress and completion report is also analyzed by the medical scientists. Again, for clinical trials involving drugs, pharmacology is essential to review the drug safety and pharmacodynamic parameters. Now, legal experts should ideally have a degree in law and specifically should be trained in medical. And again, the ethical review, so many documents are there when we undergo a clinical trial or we submit a research project. There are so many documents, specifically informed consent document. They have to be translated. We have to sign if there is a national level or multi-centric projects. We have to sign MOUs. Then clinical trial agreements are there. Some regulatory approvals are to be taken, insurance documents, site approvals, research, protocol-specific other permissions like permission to be taken from, in special conditions, to be taken from if there is research on the stem cell, then it is advisable, it is a duty of the legal expert to pursue this and to take permission from the institutional stem cell committee. Another important aspect is where there is an international collaboration, then it is a duty of the legal expert to go through this and to seek permission from this Ministry of Screening Committee, that is Health Ministry Screening Committee is there for international collaborations, and he should be well versed with the specific guidelines and regulations of these international protocols and specifically other special conditions like stem cell committee. Now again, if he should be able to interpret and inform EC members about regulation changes, if there is any, or if there is some new regulation which has arrived, he should be aware of those regulations by continuously studying them, and he should inform the EC members and should make them Then coming to the independent members, that is social scientists, representatives, part of NGOs, philosophers, ethicists, and theologians. Now, they should be individuals with social background, science, philosophy, religious qualification, training, and/or expertise. They should deal with local cultural moral values. Now, NGO can also be involved in health-related activities. Persons from NGOs who are involved in the health-related activities can also be taken as independent members. They actually assess the impact of any clinical trial or health-related activity on the community involved. That is the person or the participants from the community from which they are to be drawn. They assess the socio-cultural context, religious or philosophical context, if any, involved in the research project, which is either submitted for review or it is an ongoing research project. He actually serves as a community representative, as a patient participant or a community representative, and it brings in the ethical and societal concern in the research proposal. Now, a lay person is a literate person from a public, and it should be that he should not pursue, he has not pursued a medical health related career in the last 5 years. He may be representative of a community from which the participants are drawn, and he is aware of the local language and cultural ethos, moral values of the community, and he is responsible for the ethical review of the proposal, the informed consent document and its translation. Again, this is a very important aspect as far as the conduct of any clinical trial or study involving human participants is concerned, that is the evaluation of benefit risk. Now, the chairperson, we are talking about the chairperson, or there can be one vice chairperson also versus the chairperson. So if somehow it happens that in anticipation, if the chairperson or the vice chairperson, they are not there to attend the meeting, then it is a duty of the chairperson again to nominate a member from amongst that 50% quota. He should appoint one member as the chairperson for that particular day and time of meeting. And that person, individual who is appointed by the chairperson, will have full powers of the chairperson for that day. If chairperson and vice chairperson are absent and there is no prior information, then all the members, that is the 50% members, the members who are from the outside institution, they can nominate one of the person from amongst themselves as chairperson. Again, that person who is appointed as chairperson will have the full powers of the chairperson for that day. Now, member secretary can also appoint certain special consultants, as I said, for evaluation of the special issues like cancer research, or a pediatrician can be there, or a person involved in the cardiothoracic research can be appointed as a special member of the this ethics committee. Member secretary can also have certain alternative members to just fill up the quorum. If some members are absent, those members, alternate members, can be called in to fill up or to fill up the make the quorum complete, so that in order to continue the meeting, or the meeting can be held by calling the alternate members. So this was all about the composition, the objectives given to individual members of the ethics committee, what role they play, what responsibilities they have. Now, next we have the responsibilities of the, or the functions, you can say functions of the ethics committee. Now, the important function, as I said, of the ethics committee is to review, evaluate, and accord permission to the submitted research proposal for clinical trials involving human subjects. Now, in order to do this, the primary duty of the ethics committee is to consider the basic principles, as has been mentioned previously, that is the respect, beneficence, and the safety parameters should be concerned. So all these parameters should be taken into due consideration before according the approval. So for this, the ethics committee should review the suitability of the investigators. Actually, the suitability of the investigators means that the person who is actually going to conduct the research on human subjects, his suitability means that his qualifications should be judged, whether he is perfectly qualified to handle that situation. And secondly, his experience in clinical research and ethical issues should also be taken into due consideration before according permission for that particular research proposal. Now, review of methods and adequacy of the information. The review of method is, again, as I said, the submitted research proposals or projects should be reviewed meticulously in order to find that any method mentioned in the protocol should not jeopardize the rights of the participants. The rights, safety, and well-being of the participants should not be jeopardized. Adequacy of the information should be sufficient, that everything should be answered in a scientific manner. Now, third important aspect is review of the suitability of the facility. Facility means that the place where this actual trial or research is to be conducted. It could be an institution, it could be a medical college, a hospital, or any other agency where they have medical facilities. So for this, they have to look into the logistic support, the health facilities available. If in case some adverse event occurs, what sort of medical facilities are available for the participants, and in case of severe adverse events, what facilities can be provided to the research participants. Then this welfare and safety of the research participant is utmost importance for the the ethics committee, they should review the originally submitted one, and the person, they should also review the ongoing research projects so as to look into the matters whether the welfare and safety of the research participants are taken into consideration. Now, in case of occurrence, provide advice to the researchers. In case of occurrence of any adverse event or a serious adverse event or injury is there, so it is the duty of the ethics committee to look into this matter and to discuss with the principal investigators and the other persons involved in the research, and they should teach them and they give them proper guidance and advice as to how to deal with those severe adverse events and the injury that has occurred as a result of any treatment or any technique involved in the research methodology. And protect right of the participant, and protect dignity of the participants, and then protect the well-being of the participant. These are the three core important parameters as far as the conduction of research projects are concerned on human participants. Now, it is the duty of the EC to ensure that the universal ethical values and international scientific standards are being followed, and all in terms of scientific methods, in terms of social local community values and customs are followed while during the ongoing process of conduction of the research or clinical trial. And they should assist the ethics committee, as I said, in case of problems or if there is some issues arising out of the methodology of the research projects during the conduction of the project, during the process of the project, they should be in a position to assist in the development and education of the researchers as well as other research community, and this development and education should also be taken up to the community also. That is, the person who are being used as research participants, they should be taught and they should be educated about the outcome of the research. And then timely review of the research projects that are ongoing projects, they should be timely reviewed. And this review can be done either by the member of the research committee, or they can be assessed in terms of, say, if the reports are submitted by the sponsors, or there is some sort of monitoring committee is there who can go and monitor the progress of the research projects, or the reports coming out of the internal audit officers. So all these reports are to be timely reviewed and checked from time to time, maybe on the basis quarterly or 6 monthly or annual basis, so as to safeguard the interests of the research participants in terms of safety, this dignity and the well-being of the research participants. Now, as I said previously also, whether the study, they should also ensure if there is occurrence of any severe adverse events, and they should be in a position to teach the researchers and the persons who are involved in the actual research how to evaluate them and what measures can be taken to help the individual participants in the research. And they are also responsible for, if there is severe injury occurred during the research progress, they are in a position to decide what compensation can be given to the research participants. So in brief, this was the functioning of the ethics committee. Then we'll talk about what reviews the committee can give. So it is again divided into 3 types. One is the full committee review. That is, what projects are to be put before the full committee review. Then in the full committee review, those projects are put before the full committee review who have more than minimal risk. That is, minimal risk is defined as the risk involved is less or equal to those risks which are encountered in normal routine work, normal life. So more than minimal risks are involved, and vulnerable population. In the vulnerable population, even if the risk is minimal, then also projects related to the vulnerable population should be put up before the full committee review. Then if there are certain major protocol deviations or violations during the ongoing research process, they are put up before the full committee review. And in this major protocol deviations or violations, the full committee review decides whether to continue or discontinue the ongoing research project in view of evaluation of the benefit risk ratio to the patient or the research participant. Then in the full committee review, certain projects are also put up for ratification, like those projects which have been given exemption, or those projects which have given expedited review, or those projects which have been approved by the scientific committee or subcommittee. So all those projects are put before the full committee review for ratification, that is for final approval of the full review committee. Then we have expedited review. Expedited review doesn't mean that speed should be fast, but all those projects which have no more than minimal risk are to be put before the expedited review. And those projects which take into consideration that the samples which are non-identifiable specimens and human tissue from blood banks, tissue banks, etc. And clinical documentation material that are non-identifiable, that is, they are not in the public domain. They are in the public domain. So these projects can be put for the expedited review. Then there are certain projects where some sort of the PI or the administration wants some administrative changes. That is, they want some changes in the researchers, or other administrative changes are to be put, or there are some typographical errors. All those projects can be put before the expedited review. In the expedited review, in full committee review, all the members are to be present. That is chairman, chairperson, this secretary, and other members. That is, full quorum should be there. Minimum of 5 individuals or members should be present to fulfill the quorum protocol for full committee review. As far as the expedited review is concerned, it is the chairman and other. He can take 2 more members from the other members of the this ethics committee, and they can take decision on the expedited review. Then exemption from review, there are certain parameters which can be exempted from review. Proposal with no risk or minimal risk, systematic reviews, meta-analysis, all these can be public health programs, and then observational studies when information with or without link identifier is there. All these studies can be exempted from review. Then what decisions can be taken by the executive, this ethics committee? Either the ethics committee can approve this proposal put before the EC with or without suggestion or comments. If we find that everything is suitable, the adequacy of the place of work and the qualification and the research experience of the person who is involved in taking out that research, and the content which is mentioned in the protocol is sufficient and it is not not going to harm the patient in any way, that is, it involves no risk, or the due consideration is given to the benefit risk ratio, and if the content is found suitable, then this is given approval without suggestion of the comments. Then there can be revision with minor modification and amendments. Now again, this is equivalent to an approval, but after this it should be placed before an expedited review. So expedited review, they will follow the suggestions of the EC prior to this, and they will look for the changes and modifications and amendments that have been suggested, whether they're incorporated in the protocols or not. And then through expedited review, this process can be given approval. Then revision with major modifications for resubmission. When there are certain major issues associated with the research protocol, then it is referred back to the investigator, and he is asked to modify all those major changes at length and then resubmit. And again, this resubmission is placed before the full committee forum. And it is the decision of the approving committee, that is EC. Full committee will decide whether further to approve it or not. It is not mandatory on the EC to give approval to this resubmission. Then again, there is the EC should not approve any particular proposal which the committee finds that it is not in accordance with the rules and regulations, and it is going to cause harm to the research participants, so not approval. So comment should be noted for not approving the research proposal. Then again, I would say that ethics committee has the full right to even stop or give negative decisions on the research proposals which are ongoing. If the ethics committee, based on the reports, finds that some news is coming out of those research projects while inspecting them midway, that is quarterly or 6 months review, if they feel that some message is coming from those studies which could alter the benefit risk of the patient, then they're negative, then this can be cancelled or stopped midway. So this was about the review and decision. So this was all about the ethics committee, and these are the references. Thank you so much.
Thank you for such a wonderful presentation, sir. We will take up a couple of questions from the participant side, sir. So the first question that they have asked is, if a member of IEC has a project of his or her own, sir, then in that case, how will the IEC go about it, sir? Over to you, sir.
Actually, as I said, that it is the duty of the member secretary to look into this. He should actually call on the conflict of interest draft from all the members. So it is the duty of the member who is part of that particular research project to submit that prior to that meeting, so that he is a part or member of that particular research project. So he should not be considered. He should ideally withdraw from that. And if it does not do that, then it is an ethical issue and action will be taken against that member as per the rules and regulation of the EC.
Thank you, sir. Due to the time constraint, we will now ask the final question for the day, sir. So the question is, where is the independent ethics committee located? And how will a private practitioner find out the closest available independent ethics committee for doing research, sir? Over to you.
Actually, independent ethics committee is working at the regional and national level. So I think any state or district can have a independent ethical committee, and he can find on the website of the registering committee, because independent ethics committee is also registered with the regulatory authorities. So at the website, it is mentioned what region and what states they have independent ethics committee, so you can find it there.
Since we are getting so many questions, so one more question for you. This is the last one. The question is, are there some objective criteria for defining major or minor modifications, sir?
Major and minor modifications are actually related to the benefitic risk ratio. Since the EC is all about protecting and safeguarding the rights of the individuals who are participants in the research as subjects. So benefit risk ratio is considered duly to see whether the protocol, the measures, the techniques which are mentioned in the protocol is going to hamper the individual in a derogatory manner, then they are taken as major. And if you see that it is a minor sort of thing, then it is considered to be a minor. So actually, it is a benefit risk thing.
Thank you, sir, for answering the questions. Thank you for the presentation as well. Thank you, sir.
Oh, okay, thank you.
So, dear